again, Quality Plus for being a partner with us and being here and supporting our education and supporting you. Again, partners, I've said it 100 times already, together we're better, and that's really what we're about. Thank you for coming today and being part of our conversations about creating that 5-star agency and in using home care as a business diversification strategy. We all have a piece of the puzzle, right? And together we make the complete picture for the patient and the outcomes. With the national staffing shortages facing all sectors of healthcare, specifically in the home industry, being our best-in-class agency is really key. So our discussion is going to explore some ways, some nuggets to improve your agency's outcomes, as well as to prompt you to kind of consider maybe adding home care to your current care at home offerings. So if you haven't considered it and you're not part of that industry, maybe here's your golden egg and opportunity. So again, it's my pleasure to welcome our panelists today. Armine Kudanyan, she is from QWAPI, Guy Tomasi, and Zandra Ellis.
Oh, sorry.
You're a part of it too. We're actually maybe 2 minutes ahead, so hopefully there'll be an opportunity. If you have any questions, I'll actually let you ask at the end. So our first question is to Armine. So as a quality and compliance expert, which is why we have her on our panel, what do you see as the key issues that may arise as more organizations partner with home care agencies or expand into the home care area itself?
First, I want to say thank you. Thank you for having me on this panel. Before I start, I do want to share one story with you guys of how my journey started in home care, or my journey in development of a software started in home care. So one day I saw a picture of this polar bear slipping on ice. And it dawned on me that identification of risk is what is important in performance improvement. So knowing what your risks are. We talk about falls, we talk about rehospitalizations, we talk about patient safety, satisfaction, but unless we know the actual risk, for example, fall prevention program, unless someone talks to this polar bear about ice pick shoes, nothing else will make a difference. He will keep falling over and over and over again. So for me, it was very important to develop a software that can take data and break it down to every single instant endpoint. For example, data mining in a manual process, it's easy for small organizations. If you have 4 falls, you can do the data mining easy. But if you are a large organization, if you have multiple branches, multiple incidents, it's hard to do manual data mining. Therefore, using a software, using technology, you can break down incident data into its actual risk, which means which % of patients are falling at home versus in a facility. Are they tripping and falling, or are they dizzy and falling? Because your interventions change. And once you know the risk and then you have the proper interventions, you're able to really make a difference for that patient. And so as home care and home health come together, some of the main issues are the support that home care can provide to home health in making sure to continue the conversation and the implementation of these improvement measures with the patient. Because you can teach the patient fall prevention measures, however, with the home care provider there, they can continuously follow these instructions and make these changes that Guy spoke about. And it's very, very valuable to home care and to patients and to staff. With staff shortage, we talk about staff shortage, clinicians being some of our valuable resources, limited resources. It's important for them to have more time to spend with patients rather than, you know, spending time on manual paper-based processes. Also, another use of technology is putting quality data in the hands of the frontline clinician. There's always a divide between, you know, we always say suits at the table and frontline providers, because we can sit and we can make policies, procedures, processes, and you know, you train staff, clinicians about these new processes and policies, and you know, I've seen it. They look at you like, yeah, that's great around the table, but once you're back to reality
Never
at
mind.
home,
What did you say?
yeah,
No, I don't
that's
know
great.
anything about
Yeah,
that.
no, that's great. So it's very important to bring the frontline staff to the table of quality discussions. And they can do that through technology by having access to these dashboards. They can, for themselves, open an app and see, you know, I did A, B, C, D, I followed these processes, I taught my patient, you know, we have this new performance improvement project, here's our pilot program, we're trying it, is it helping, is it working? When they have direct access to the data, it's a big motivator to become a part of the solution and to have more clinical buy-in into performance improvement measures. And that's what makes the difference, because we have to do it for real. If we don't do it for real, it doesn't count. So it has to come from the frontline providers.
Excellent. So do you see with those processes, are there any other regulatory considerations that kind of come into play with the interaction of CMS regulated service lines, you know, and non-regulated home care?
I think, although home care is not CMS regulated, I know there are a lot of local and state regulations that home care must adhere
Great
to.
point.
So it's very important for home health to learn these regulations and to know what some of the limitations are. One issue that comes to mind is medication management. For a home health nurse to, for example, let's say with both service lines, if you have a home care provider as the patient's caregiver, a home health nurse needs to know the limitations of teaching medication management to this caregiver, because it is the home care caregiver is different than a family caregiver who may administer medications, who may be taught to do insulin injections, whereas a home care provider, correct me if I'm wrong, is not allowed to.
Yeah, you're correct.
So the patient must be able to independently take the medication with reminders and with,
Huge problem.
the caregiver can hand them the medications, but they cannot administer the medications. So a home health organization, as they integrate to service lines, need to be aware of these regulations to make sure that they're providing the correct teaching or education to the correct caregiver types.
Excellent, thank you so much.
Thank you.
Zandra, this question is for you. So